So good morning, everybody. My name is Chantal Lindo-Davies. I'm Senior Project Worker at the Children's Society Food Programme, and I'd like to welcome you to our third webinar, Supporting Young Carers and Families, Joint Working with Health Services. So we have a few people on the team that are here. We have Kate Eisted, who is Information and Resources Development Worker at the Children's Society Food Programme. And we also have Fraser Cook, Project Officer for Making a Step Change for Carers Trust. I also believe that we have Bill Badham out there somewhere, who's a consultant with us, who's working with the Trailblazers.
Yep, I'm here.
Participation. And I think Daniel is there as well. So we have Daniel Phelps from Carers Trust. So welcome, everybody. And also welcome to our Trailblazers who've also signed in. So we've seen a lot of exciting developments happening in the world of health at the moment, particularly in relation to young carers and their families. So for us, it was really important to sort of hold a space for this webinar. We'll be looking at the different tools and resources that are available, and then we'll also have some presentations from two of our Trailblazer areas about health partnerships in their areas. Next slide, please. So just a little bit of housekeeping. The webinar will last for approximately an hour. Next slide, please. The webinar is being recorded and edited for anonymity to share on our website in the coming weeks. So that will be available on makingastepchange.info. And if you're struggling with anything to do with the webinar, if you wanted to ask us any questions, as you can email Fraser Cook, so that's fcook@carers.org. If you're on the phone and you want to email any questions, then you can email them over to Fraser. Next slide, please. So everybody is muted, and the video is blocked during the webinar. So, like I said, if you're joining via phone, you'll be given a chance to ask questions at the end, and other attendees can ask questions inside. All of you should have been sent slides for the webinar, so if you're having any troubles, you should be able to see. Okay, so the aim of this webinar, as I said, is to promote a greater understanding of how health professionals are supporting young carers and their families, and to share some practice and resources for engaging with health services to increase identification and support. Next slide, please. So as many of you know, there's changes to the Children and Families Act and the Care Act, and these changes significantly strengthen the rights for young carers. So as we've discussed previously, when in place, local authorities need to consider how supporting an adult with care needs can prevent a young carer from undertaking inappropriate or excessive care. And then equally, when a child is identified as a young carer, the needs of the person cared for should be considered. So if you want to know any more information about this particularly, you can find information on our website. But both of these pieces promote whole family working, and the Memorandum of Understanding underpins that. And also in there, which is relevant to this, is that the legislation has introduced something where the NHS is required to cooperate with children and adult services. Next slide. I know some of you are having trouble with my voice being heard, so I'm trying to move closer to the microphone. Let me know if that's okay. So how does this work for health then? So it states here that there's the Care and Support Statutory Guidance here, which is issued under the Care Act, which says that local authorities must carry out their care and support responsibilities with the aim of joining up services provided or other actions taken with those provided by the NHS and other health-related services. The local authority isn't solely responsible for promoting integration with the NHS, and this responsibility reflects similar duties placed on the NHS England and the clinical commissioning groups to promote integration with care and support under the NHS Act. It says that NHS England must encourage partnership arrangements between CCGs and local authorities, where it considers that this would ensure the integrated provision of health services and that it would improve the quality of services or reduce inequalities. And later in the webinar, you'll hear a bit about how various partnership arrangements are working on the ground. Next slide. So before we go to those presentations, I just wanted to highlight a range of tools and resources that are related to young carers in the health sector. So for some time, young people, families and professionals obviously have told us how important it is for health professionals to receive training and information on the needs of young carers. And they've said things around, in order to help them identify young carers, make appropriate referrals to other agencies, provide age-appropriate information to young carers about their parents' or siblings' conditions, understand potential issues that young carers may face when, for example, family members are discharged from hospital. So one event that happened in order to get young carers' messages heard was the NHS Change Day, which was an opportunity created for young carers to influence strategic leaders and policymakers regarding the impact of the caring role on the health and well-being of young people. So from that, 65 young carers met at London Zoo and designed the day in partnership with the NHS Improving Quality, NHS England, Royal College of General Practitioners, Carers UK, Carers Trust and the Children's Society. And you'll see the key messages there on the slides about making services more accessible, better identification, services working together, recognising the need to communicate, and then think patient, think carer, think family. So really ensuring that young people are not. Next slide, please. So through this day, then, professionals were asked to make pinky pledges with the young carers. So there were actions that were to be taken in 1 week and then longer term within 6 months to improve the health and well-being of young carers. Next slide. So this all informed the commitment to carers. So these are 37 commitments spread across 8 key priorities, which you'll see there on the slide. And they include raising the profile of carers, education and training, person-centred coordination care and primary care that have been developed in partnership with carers, patients, partner organisations and care professionals. There is also the NHS commissioning for carers. So from this, there is also that document which includes young carers throughout it, and there's commissioning for carers principles. So there's 4 key actions that mean that you're most likely to achieve the best outcomes from evidence and case studies that they've received. And it's really to help commissioners consider current commissioning practices with regards to carers and how they could be improved. There's sort of simple self-assessment questionnaires and things like that that are really useful to use. Next slide, please. So the Royal College of General Practitioners website holds a lot of resources too. The RCGP's Supporting Carers programme closed in March 2015, but you'll still find lots of really useful stuff out there. Again, there's some commissioning guidance on there, which also has some high-level principles and self-assessment tools. And then alongside that, there are resources to support effective commissioning for young carers. So it's kind of practical tool alongside a suite of other products that will help commissioners to deliver what carers say is really important for them. Next slide, please. The RCGP also, with funding from the Department of Health, developed the Caring for Carers Hub. So that provides information for primary care staff about how to help carers. And it's about how to help carers focusing on their own health and well-being whilst they're looking after someone else. Next slide. So the hub provides information about well-being. You can see it here, it's quite localised. Next slide. And then there are various tools within that. So primary care staff can access this and they can find relevant information, relevant tools that are national alongside local information. Next slide, please. There's also various resources for school and community nurses. So on the RCN website, the Royal College of Nurses website, there's training available for school nurses. Next slide. And we've delivered several training sessions over the years to school nurses who, as you all know, are ideally positioned to play that kind of pivotal role by ensuring that young carers are identified early and that they receive timely, age-appropriate information. They're really well placed to sort of bridge the gap, really, between health and education as well. And the same with health visitors, where they can play a key role in providing families with information. You know, they're obviously there very early on when children are young, and they work across 4 levels. So working, with the community, working with universal services, Universal Plus, they're giving information on illness and health as well, and then Partnership Plus, which is around multi-agency work to support the whole family. Next slide, please. So alongside this is the school nurse pathway, which is a really useful tool, but it's particularly aimed at school nursing services. But it will also be of interest to any professionals and provider organisations or commissioners. So there's lots of these resources out there that are available for those working within health to gain a better understanding, to develop. They've got training, online tools, so that they have a better understanding of how to support their carers and their families. Next slide, please. Finally, we have a resource here which, again, is from the Royal College of Nursing. It's for all nurses, really, just to identify that there are extra tools and resources available on that website. Next slide, please. That's a bit of a whiz through some of the resources that are available. We'd really like to update this list. So if there's anything else you guys know of you think would be useful, then please do send that across. You could type it in the message bar. We're recording that. But you can also email us. That would be really useful, and then we can compile all of that information. Before I move on, sorry, Fraser. So some of you might have also noted that NHS England are developing a memorandum of understanding for carers, including young carers. So this is designed to promote joint working within the health and social care system in each local area. It's really an exciting development in health, and it will reinforce the value of all the partnership working that's being developed nationally, really. And it will, of course, complement the local memorandum of understanding for young carers. Just moving on to the next slide. Just wanted to highlight 2 events coming up. So firstly, we have our conference on the 2nd of March. We're going to be reflecting on our learning and then looking forward to what's changed in terms of rights for young carers, what things have come into force. You'll hear more from all of the local authority trailblazers, and you'll also be able to attend workshops around various different themes. So if you'd like to sign up to that, then that would be fantastic. Again, you can email us. Next slide. And finally, what I think will be useful for everybody that's signed in is that we're going to have another conference which really focuses on health, and that's on the 31st of March. So it's a big networking event, and it will be really looking in depth at developing the young carers and health agenda. And there will be more information, hopefully available at that point, about the memorandum of understanding that's being developed by the NHS. If you'd like any more information about any of that, then you can email us and we can sign you up. Thank you. Next slide, please. So if anyone has any questions or comments, feel free to type them in the text box. Thank you for those of you who have highlighted some resources.
I've also unmuted everyone, so please feel free to speak as well and ask questions directly as well.
Okay, thank you everyone. What I'm going to do is move us on now. We click onto the next slide. Sorry, I got muted there for a second. There'll be more opportunity to ask questions at the end. So I'd really like to welcome Lisa and Louise. Lisa is from Liverpool CCG and Louise Wardell from Keeping Family in Mind at Barnardo's. Over to you guys, thank you.
Hi, thank you, Chantel. It's Louise from Barnardo's and Lisa, who is from our CCG. Hello. And we're also really fortunate to have, also with us in the room, is Jane Weller, who's our local authority, Liverpool City Council Commissioner as well. So that's really great that the three of us are all huddled together in our premises this morning. So what Lisa and I are going to talk about is around the mental health and emotional wellbeing of young carers, and really importantly about how our child and adolescent mental health services, and equally as important, our adult mental health, can work together to support the whole family. Okay, next slide. So what we're going to cover is, we think it's really important about, if we're explaining where we've come from, to put it into some wider context. It's really good what Chantel's talked through already, but I think all of us that are out there working kind of feel health is absolutely massive agenda. And there are so many components to health. And what we want to share with you is how, for us, it's really important to work with our colleagues who are on adult mental health, the providers. And so our provider, I'll probably slip into just calling them Merseycare, because that's who our adult mental health providers are, who work with adults with learning disabilities, mental health, substance misuse. We also want to share with you about why, for us, the whole issue of a whole systems change is so important, and that health is part of that whole system change, and that for us to move away from thinking as health as a separate dimension, but is absolutely integral. And then sharing with you what's been working well for us here, and how that continues, in particular, to bring you bang up to date, and Lisa's going to do that, about the whole transforming CAMHS agenda and why commissioning is so important. So that's what we're going to cover. Next slide, please. Okay. For us, historically, our Young Carers Service has been established since 2001, so we've been going, coming up for 25 years, but that doesn't mean that we've stayed kind of working to the same agenda. We've been changing considerably over the years in line with what young carers and their parents and families tell us. But where the work began for us was way back in '99 with health. So we've got a long history of working with our colleagues there, and we did some local research, and I think that's always really important. Yeah, national research plays a big part, but I think you need to, in some ways, have your local research to be able to have, in some ways, to shine a light on what's happening in your locality. And for us, what we felt was back in 2001 that having development work and strategic work was so important when we were working across the whole system, but particularly with our colleagues in adult mental health. And that was where the title Keeping the Family in Mind came from. It came from our research, and what we did was we developed it to be part and parcel of our overall service. So in many ways we've got a direct service delivery and our strategic work, and that is now commissioned jointly by Liverpool Clinical Commissioning Group and Liverpool City Council. Next slide, please. What's been so important for us, and some of you may have seen this slide before, and we make no excuses for not showing for showing it again. Jane Weller, our local authority commissioner, and myself did a webinar back in December talking about our pathway, and we used this slide then. And importantly, the slide, you'll see that the only logo on it is up in the top right-hand corner. And that was a logo, which is called the Jelly Baby logo, that's been developed by our young carers when they want services to really think about them and their families. And so the reason for our slide looking like that is it's about all agencies working together. And it's about working in partnership. And for us, this work really did begin by really listening very much to those experiences that children and families experienced. And the first quote there just hits the nail on the head. That was from a 12-year-old who was talking about adult mental health. And she was talking about, you know, that adult mental health, in her experience, often said things like, well, we only work with your mum. But as the young person, the young carer said, well, my mum lives with me, so we're all connected. So she was kind of saying, you know, absolutely, people need to be joined up. And I'm telling, you know, I'm preaching to the converted here with everybody who's listening in today, so I know that. The second quote there was from a lone parent who'd got 3 children under the age of 7. And she, again, really pointedly expresses that often your needs are separated out, and adult services, children's services, and what's so important for us is that the whole picture needs to be seen. And so for us, it was those very powerful experiences that have led us in this city to work much more in partnership, particularly with our health colleagues. Next slide. Okay, so the rationale, a couple of years ago, we were one of the implementers of the Social Care Institute for Excellence, Think Child, Think Parent, Think Family. And I suppose the reason for putting this in was just to remind about why is it so important to work with our colleagues in health. So this is some of that rationale. So we know a third of UK adults have mental health problems, but we are parents, but we also know that many of those parents absolutely parent their children effectively and have come of no concern whatsoever. Alternatively, we also know that families who are affected by parental mental health can and do experience poor outcomes. Next slide. What we also know is that there are risks to children, and we know that parental mental ill health is a factor in a third of the serious case reviews. That's nationally, and it will pan out for you locally in your areas. We also know that up to 2/3 of children whose parents have mental health problems will experience mental health difficulties themselves. So if that isn't a kind of call and rationale for saying to our colleagues in CAM services that we need to get this right early, because these will end up being adult mental health service users, which is what we don't want. We also know that up to a third of young carers who are caring for parents with mental health problems are least likely to be offered a carer's assessment. So those are all the reasons we know that are really pushing, and there's massive evidence base. You only need to jump onto the Sky, Social Care Institute for Excellence, Think Child, Think Parent, Think Family, and you'll see all the evidence base behind those factors there. Next slide. So, cutting quickly on a whistle-stop tour of where we've been going in Liverpool, the things that we've been doing with our colleagues in health, and not just health, we want to really stress this, that we don't see health as a separate entity in the city. We see health as part and parcel of that systems change. So, there's the Jelly Baby kite mark. I think that was one of the first things that we developed a number of years ago when we developed our family rooms. So every single unit, and there are 17 of them, and they also include Ashworth High Secure Unit, all have family rooms where they are kite marked, and therefore the seal of approval is set by those young people who are best placed, given their experiences, to tell us that. We've also had for a number of years a young carers joint policy and procedure with our colleagues in health. That is being rewritten now in light of the new legislation, so we can keep you posted on that. We've also developed what we call our message in a bottle. We've got another slide on that. Our family support workers, will tell you a little bit more about that. So important as the information that children and young people needs to be informed by them, so we've done a lot of work around that. And we've also had for a number of years a Merseycare Trust-wide Women and Think Family steering group. So that's about supporting the Adult Mental Health Trust to be really at the top of the game and to support them. And what we stress about what's working well is constantly reminding that it's the workforce that are absolutely essential to this. So we do a lot of additional support and training with our colleagues in health. Next slide. So what's making a difference? There you have it. The family rooms, been award-winning. Great sense of organisational pride. Don't take a lot of resource, but my word, they make a massive difference. Those rooms have been evaluated over the last couple of years, and all that information can be found on the Merseycare website, so we can make sure you have those links. Next slide. What we've also developed with our colleagues in Merseycare and with the CCG is a family support worker model. What we tried to do was to ensure that our community mental health teams have each got a family support worker. So basically that is somebody that is employed by the Adult Mental Health Trust that works directly as part of their community mental health team. Their remit is much wider than young carers. Their remit is about children and young people. So in some ways, it's really good because it's about early help. It's about making sure that those parents who are receiving a support from adult mental health actually think about the whole family, and the family support worker can do some really good work. And again, we've evaluated that, and that research is also available on the Merseycare website. Next slide. We developed a number of resources. The little one on the left-hand side was a little booklet that we made with our family support workers called Our Hospital, and this is to support children under the age of 5 when their parent needs to be admitted into a psychiatric unit. Again, really needs-led, really thinks about the family. And the resource on the right-hand side is one that we made a number of years ago called Keeping the Family in Mind Resource Pack, and again has a number of components in it. It is a good few years old now, but we still find that professionals find it really, really helpful, and is aimed at professionals to support them in their work that they can do. Next slide. There's the message in a bottle we mentioned before. Some of you will know that the Lions organisation a number of years ago developed little pots that people could put information in. We got their permission to adapt the pot and to again get it kite marked by our young people. There's your Jelly Baby logo. And basically what happens is we work with families to ensure that there is an emergency plan, a safety plan. So when things are tough, that they know who they can call, what the phone numbers, and the quote there just kind of sums it up. You know, a young person, a young carer age 10 saying, you know, that they notice things, they know when things aren't going well. So it's really, really important that the support mechanisms place the family at the heart and make sure that they know where and who they can go to for extra support in a crisis. And we ensure that the family support workers and our colleagues in Merseycare also ensure that their families can use these. Next slide. So what really helps? Again, this is a kind of list of things that we've developed that we've learnt over the years. So again, we have what we call our 10 messages. So that's making sure that we have a list of 10 messages to our adult mental health professionals and to all professionals to think about. And the first message is to professionals is introduce yourself, tell me who you are and what your job is. That's what young carers tell us is important. We know information is important, and we know how important it is to talk to children, but to ensure that they understand, involve them. The point there around identifying young carers is very timely now with the legislation, and certainly for us in Liverpool, that is so important around the assessment and to make sure that we identify those young carers early and we can intervene. What's also really important is, as we've said and we've stressed a few times in our presentation, is about that whole multi-agency approach, which does need senior level commitment, and we are very fortunate in this city we have got that commitment to develop that way of working with a no wrong door approach. Next slide. I'm now going to hand over to Lisa now, who's our CAMS Commissioner.
Hi, my name's Lisa Nolan, and I work for Liverpool CCG. I work in the Children and Maternity Commissioning team. I'm just going to run through what we're doing really around transforming CAMS, and obviously young carers are integral to that. Next slide, please. Okay, and the best way to do this really is to go through our CAMS integrated pathway, which we now call our offer in Liverpool. And what we're heading towards is commissioning a comprehensive CAMS offer for 0 to 25-year-olds. And our main outcome really is to improve the mental health of all children and young people and their families, and obviously young carers fit within that group, and young adult carers as well. So I'm just going to run through the pathway with you and the offer, and go really just give some brief detail around what each part of that pathway and each of those boxes means really, and what we're doing. I guess we've been transforming CAMS for a good number of years now, and there's been little investment really nationally since 2003. However, there has just been a national inquiry into CAMS last year, and a report called Future in Mind, which was published last year, which included a number of recommendations with regards to what a comprehensive CAMS offer should look like. And alongside that came some additional resource as well, and money. We moved to an integrated CAMS pathway and offer a couple of years ago in Liverpool, and I guess we were a bit ahead of the game with regards to the Future in Mind report, and we were involved in informing that as well. So what we're doing now is we're just continually improving it and developing it. So if you look at the first box there, it says universal services and community neighbourhoods. What we're about is really trying to increase the capacity and the awareness within communities and universal services around mental health and emotional well-being. We have a 3-year strategy in Liverpool. I think we're on our 5th strategy now and transformational plan. And our aim has always been really and our vision has been to make mental health and emotional well-being everyone's business. And in doing that, we've put a lot of services in place to not only promote mental health and emotional well-being in neighbourhoods and communities, but a number of services across a number of organisations who work together to provide services to support children and young people's mental health and emotional well-being. Bernardo's Young Carers is one of our core providers, which we jointly commission with the local authority. And they obviously do a lot of awareness raising around the needs of young carers. I guess as part of that as well, we are developing our community mental health hubs. We've only got one at the moment in our central part of Liverpool, and it is a youth information advice and counselling service delivered by one of our voluntary sector providers, YPAS. And we will be rolling that model out across the other 2 localities in Liverpool North and South. And what they offer is a drop-ins. They're open access, and they offer drop-ins, support services, information advice and guidance, psychoeducation, family learning programmes, and therapeutic support as well. And I guess young carers is integral to that, and we hope that those hubs will become more integrated with our other providers. Our other CAMS providers consist of Alderhay NHS Children's Hospital and Merseycare, and a number of voluntary sector organisations such as Bernardo's, where in YPAS we have a trauma-based service called PSS Spinning World. We also have ADHD Foundation, which support children and young people with ADHD and their families. Another neurodevelopmental service called Advanced Solutions, which again offers family support and open access for children and young people with neurodevelopmental conditions. And we have Merseyside Youth Association, who deliver a lot of our mental health promotion, engagement and participation, which, as you can see from the offer, that runs across the pathway with workforce development. And again, young carers deliver a lot of that as part of their specification. They have fantastic and excellent participation and engagement, and a lot of young carers are involved in the development and design and some delivery of our CAMS provision. specifically when it comes to training and awareness raising and development of some resources as well. And then Barnardo's Young Carers obviously deliver a lot of workforce development around raising the awareness of the needs of young carers and adult carers. In Liverpool we have a CAMS, what we call a CAMS partnership. That's what we call all our services who deliver to this offer. And we have a workforce development agenda, which is free to the workforce and delivered by all our partners, and obviously young carers are part of that delivery as well. And that can be accessed through our CAMS website, which is www.liverpoolfyi.com. And people can book on the courses there. And that's coordinated through Merseyside Youth Association. So I guess we've got the community mental health hubs, and then we'll have, within each of those hubs, we'll have a single point of access. We do have a single point of access at the moment, which is citywide, where all our referrals come in around mental health. And within that single point of access, it operates a multi-agency virtual approach, in that all our CAMS providers have partnership agreements in place to offer joint assessment, joint working, and obviously work with to support the needs of those young people. So if a referral comes into the single point of access and really isn't, the single point of access is hosted through Alder Hey, one of our NHS CAMS provider, and it's not suitable for Alder Hey, then they'll be passed to the relevant organisation. So the referral will go to the right place at the right time. And we offer a range of targeted and specialist support within our CAMS offer as well, and that's through the number of providers that I've just mentioned, a lot of evidence-based interventions. We also have a transition support from children to adults as well, and they do a lot of work with children, young people who go into inpatient care and out of hospitals as well. And obviously they support, they work with Barnardo's Young Carers as well, specifically around young adult carers. And then we do a lot of, we're just trying to develop our digital technology now, really, around self-care and easy access, and there's a number of developments in the pipeline, including some online counselling as well. But I guess what I really want to get across is that young carers provide a service across this pathway, really, because obviously we want to improve the mental health of children, young people, all children, young people and families. So they're integral to the delivery of all the offer, really, in Liverpool of mental health provision for children, young people. Next slide, please. And I guess how we've done that is we've remodelled existing provision, and we've done that through a number of years as needs has changed. We've now received obviously some national funding. The CCG is looking to invest in a youth mental health model as well, which will help us further develop the 0 to 25 offer. And we obviously work together, commissioners and providers. Commission providers work very well together in Liverpool. Commissioners work very well together across the council, the health and schools too, to commission needs-led services, and we've all got very good relationships with providers. Next slide, please.
Okay. So that slide was just summing up really around the whole process, really about, you know, whole family approach really does mean that you're going to get to those issues. So we've got to work together. There's no other way of doing it. And I think the final plea there from a young person was, a young carer is, you know, can you see me? Can you hear me? Then why did you ignore me? And I think that is very much our mantra in the city. Thank you.
Thank you.
Do you want to add anything, Jane?
That's lovely. Thank you so much. What I'm going to do, Lisa and Louise, if you don't mind, is I'm just going to move on so we can hear from Debbie, and then we'll take questions about the whole thing at the end. So I'd like to hand over to Debbie, Hustings Partnership Manager. Thanks, Debbie.
Hi, Hi, hello to everyone from Surrey. I sound like I'm giving a score from the Eurovision Song Contest. But that aside, I'm sitting with my colleagues, John Bangs, Senior Commissioning Manager from the County Council, and Ron Critcher, Carers Policy Officer. So we wanted to talk a little bit to you and share with you a little bit about our approach. You will see from the top of this slide all our partners, and a bit like what Louise and Lisa were just saying from Liverpool, Surrey believes very much in strong partnership working, and we believe very much that that has to be party not only with CCGs and NHS providers, but very much with the County Council. We have borough and district councils in Surrey, and also very much with our voluntary sector. Thank you. Next slide. Okay, oh, no, there we go, fading away there. Just to give you a bit of an idea of how many young carers we have in Surrey, based on the BBC Kids Who Care 2010 report, we estimate we've got about 14,000 carers here in Surrey, just to give you a bit of a benchmark. Thank you, next slide. And last year, what we did was we decided we wanted to benchmark how our performance was with young carers. And our first port of call for this benchmarking exercise was to go to our Surrey Young Carers Service. They provide our generic young carers service right across the county. And we looked at their data return for monitoring who the referrers were. And I've just included their table here because it was very clear to us when we looked at this that where we all thought that GPs would be the main portal and access to support services, this clearly wasn't being evidenced. And so we realised that although most young carers will almost certainly have a GP and very few will have a social worker, they weren't accessing services through HAL. The other area that we looked at was every year we do, in fact twice a year, 6 monthly monitoring, we look at how many adult carers are registered with their GP. And at the end of last year, we did a benchmarking survey with our 129 practices to ascertain how many young carers were registered. And again, this highlighted to us that young carers weren't really recognised within our primary care practices. Thank you. Next slide. Okay, so our starting point was very much to look at producing and agreeing with all our partners a new Surrey Young Carer strategy. In Surrey, we've got an adult one, but we also have a young one. And 2 years ago, we all met at a big conference in 2014. I think there was nearly 200 participants there, including young carers themselves, to actually co-design and co-develop this strategy. Now that was launched, and last year we reconvened to see where we had got sort of 1 year on. And I'm delighted to say that in Surrey, all the 6 CCGs had signed up to the strategy and produced their own action plans. Not only that, our 3 big community providers and our mental health provider had also signed up. Now, the big sea change for us in Surrey, as the previous strategy, was very much around us in the commissioning world producing an action plan, a sort of a one big action plan that we monitored through our Surrey Young Carers Strategy Group. And we changed. We decided we weren't going to do that this time. What we wanted to do was to actually encourage all our providers to produce their own action plans. And this has been a really big sea change for us, because actually what it is encouraged is innovation and very different thinking. When you bring the providers in, they think very differently from commissioners, but collectively and in cooperation with each other, our goals and aims are the same. So we've done some really exciting work with our 3 providers, Virgin Care, First Community Health and CSH Surrey. And I'm going to talk a little bit more about that later on in the presentation. Thank you. Next slide. The other thing that we knew that we didn't have was any really solid and robust health surveillance around young carers and the way caring might impact on their health. So we undertook a young carers health survey. We recognised we needed to do this back in 2011 when we did a big adult carers survey, and there were some fundamental differences in the two results between the adults and the children. And I'm just going to run through some of the key findings. The first one was that, we found that in average in Surrey that young carers were caring for about 14 hours a week, which I think ties in with the national picture of about 12 hours a week. What we found was that 11% had sustained an injury due to their caring role, with less than half having told their GP that they were caring for anyone. So that was quite a big finding, and very different from the adult carers survey, where physical health was really evident as an impact. Thank you. Next slide. Now, these were the areas that we perhaps hadn't anticipated and which were real reasons for concern for us. I think none of us had anticipated that 35% had recognised the symptoms of an eating disorder. We also found that 9% had self-harmed. The other two results there are probably less surprising: the difficulty to socialise and the difficulty when we're struggling with keeping up to work, both which will have a mental health impact on young carers. And overall, our survey suggested that about 80% of the young carers who completed the survey had felt that there'd been a mental health impact to their role. Thank you. Next slide. So what did the young carers tell us out of this survey they wanted? Well, I suspect anyone reading that list there this will chime with you. But what have we done to actually move those outcomes forward? Well, around identification, we've now made sure that as commissioners, that features, the identification of young carers features in every one of our NHS contracts. We haven't got a specific KPI in those contracts around that, because in Surrey we have something called a carer's prescription, which helps us monitor numbers of young carers registered and going and being processed. But that's very significant. Recognition, being included, are all actions that we've taken through our Surrey Carers and NHS Providers Network. And safeguarding has also featured, and I'll talk a little bit about that as we go along. Thank you. Next slide. Now, I think a bit like what our colleagues in Liverpool were saying, Lisa and Louise, very much we felt that we need a whole systems approach across the whole healthcare system where young carers are concerned. We couldn't think of this in silos, and we wanted to make sure that we really had the ambition of the No Wrong Doors Memorandum of Understanding embedded in all our work. So we developed our own young carers pathway, which I'll refer to in a minute. It's not rocket science, but we also adapted the National Schools Nurse pathway that Chantal referred to at the beginning of this presentation. And we set up a school nurses group that we meet quarterly to look at progress that we're making in identifying young carers and actually making sure that we're getting those referrals through to our young carer service. And I've mentioned that we have a Surrey-wide carers and NHS providers network. Now that's now grown to over 50 carer leads. That's 50 NHS carer leads who are working in our 5 acutes, our 3 community, mental health and our ambulance service. And all of them are working to ensure that young carers are recognised. And things like we would never have anticipated, like this year, well actually this week, Royal Surrey County Hospital is having a carers event this week which will include young carers, and Frimley Park Hospital, which is another one of our big acutes, is actually holding a young carers awareness day at the hospital on the 28th. So those are very exciting outcomes that we wouldn't have anticipated had we not had our network and action plan. The other areas that we are looking at is military young carers, and I'm going to talk a little bit about that later on. Obviously, we've got the triangle of care for young carers and young adult carers, and that's been fully embraced by our mental health provider, Surrey and Borders Mental Health Trust, and we have an action plan with them. And I'm going to talk again a little bit about the mental health work, but I'd like to talk now just a little bit about community pharmacy. We have 212 community pharmacists here in Surrey, and I'm delighted to say that we've now run 2 education programs with those community pharmacies, making very good use of the Carers Trust work that they have developed. And we are looking forward this year to actually rolling out our carers prescription with these community pharmacies, and young carers have featured very much as part of that. We also have identification of young carers in our continuing healthcare service, and we now have up and running, one of our hospitals has a carer support service, actually based in the hospital, providing on-the-spot advice and information, and that has included identifying young carers. But more importantly, it's about allowing health staff and encouraging health staff to own those important processes of identifying young carers. Some of the things that we've looked at, as I've mentioned, are GP young carers registrations. We monitor that. We also monitor GP young carers breaks in Surrey. We have a GP a direct payment that carers can access if they meet an eligibility criteria around impact on their health. But we're also looking at some other things. We held a medicine management day for young carers that was funded by the CCG last year, and as a result of that, we're now developing resources for young carers which are age appropriate around medicine management. And we are looking actually in March to be running some young carers self-management courses, which is principally around resilience training. And finally, we work always with our Young Carers Forum, and just last week we were working with them on how to incorporate young carers within our Friends and Families test. Thank you. Next slide. So I've mentioned the triangle of care, and actually our mental health provider, Surrey and Borders, have signed up to this and are working to implement the 6 standards. And they've also signed up to the No Wrong Doors. But far more interesting and more successful has been their own developed action plan, which Ron, my colleague sitting next to me, and I help them develop and monitor. Thank you. Next slide. And one of the things that we've done is a bit like what our colleagues in Liverpool were talking about, is provide in partnership with Virgin Care and Surrey Young Carers Service, a resource for young carers whose parents have been admitted into acute psychiatric care. You'll see here on the slide it talks about the Abraham Cowley unit, and that's one of our acute psychiatric care facilities here in Surrey. And basically the young carers told us what they would like to see in this rucksack and what resources would be available. So you'll see a selection of things that are included in the rucksack, and they also have information in that rucksack. Now, we have launched that, and what is really exciting is the feedback from the NHS staff is very positive. It provides a real icebreaker for them to engage with young carers when they're identifying them, and the young carers themselves feel really valued with receiving this. So we're really excited about this, and we're looking forward to rolling that out into our new facility, which is opening at the Farnham Road Hospital in the new year. Next slide. And I think I mentioned that we've developed our own Surrey Young Carers pathway, and none of this is rocket science. One area that keeps coming up is around the need for parental consent. And so a lot of the training we've been doing with NHS staff is around Gillett competency test and the Fraser guidance, and very much encouraging them to use also the Royal College General Practitioners confidentiality leaflet and advice, so that we are ensuring that these young carers do not have barriers in way of them accessing services. Next slide. And I've mentioned our carers prescription. Our carers prescription is our online secure referral mechanism for all our carers services in here. It's a practical solution for any NHS practitioner, be they GP, a hospital discharge coordinator, or a busy pharmacist, to actually, once they've identified the carer, to easily access all the different services. It takes about just over a minute for them to complete. And it includes access to all the young carer services. Next slide. So we have a young carer service here in Surrey. It's just coming up to its 20th birthday this month, and they provide the support to the young carers, and currently they are providing support to just shy of 2,000 young carers. Thank you. Next slide. But what we've known is that we need to build capacity. You remember I've said we've got 14,000 young carers in Surrey, and we need to build that to help meet that unmet need. So you'll see there's some year-on-year statistics where we have provided them with some more funding now through the Better Care Fund, with the hope to increase capacity this year. Next slide. I mentioned earlier about the eating disorders, and one of the results of that particular issue has been a new publication which was developed and co-designed with young carers, explaining to them what a eating disorders is and what the symptoms are and what support is available to them. Which I think, has been very favourably received, and certainly by our mental health providers. It's a very useful resource for them. Next slide. And this is a poster campaign, because obviously I've mentioned our community providers, but I haven't said much about our acute providers. We've done training with all our acute providers staff right through the whole systems, and an example of this would be the Royal Surrey County Hospital. These are posters that we have on display throughout our hospitals. It's not only meant to be and speak to young carers themselves, it's meant to speak to staff to remind them that we mustn't assume that children don't care. And I think that was a very powerful strap line that they used. Next slide. So I mentioned about military young carers. We became aware of this issue, or the potential of this issue, through the campaign our colleague up north, Paul Watson, who leads on. He's a national campaign to raise awareness about military young carers. We know in Surrey we have just over 3,500 armed forces personnel living here. We do not know the population side of our veterans, but we do know from health surveillance that military families have a higher prevalence of caring than those in the civilian world, and we've never reached out to them. So this year is our year to reach out to them. We have 5 MOD practices in Surrey, and we are working with them so that they can access all our services. And on the flip side, we're also working with all the charities that currently support armed forces families and veterans to ensure that they're aware of the services available in the community. Next slide. And that's a picture of Ron and I, just so you know what we look like. I'm afraid John wouldn't be in the photo because he's far too pretty to be next to us too. But we welcome any questions that we don't have time for today in the Q&A session. I hope you found that of interest, and thank you very much for the opportunity for us to share and learn from you. Thank you.
That's great. Thank you, Debbie. So we're bang on 12 o'clock, so I know some of you may have to leave, but that's fine. But if anybody does have any questions they want for either Debbie or Felicia or Louise or myself, then please go ahead. I believe Fraser has unmuted those of you on the phone, and the rest of you can type something you wish.
Also, please feel free to write them in the conversation window, and then Chantal can read them out.
Hi Debbie, my name's Natalie. I work for a local authority in Windsor and Maidenhead. And I just wanted to ask, who actually led all of this, all of the work that's happened in Surrey? Was it local authority? Was it yourself? Whose agenda was it, and who drove it forward?
Well, I think in fairness to us here in Surrey, this is my point about the partnership approach. I am a dedicated NHS carers lead, which I think does help in that I don't actually cover any other commissioning portfolio, so I am purely there to lead on the NHS carers agenda, but I do everything in concert with my local authority partners and with our voluntary sector providers. So, and I think the other thing that has made the big difference for us in Surrey is having that carers and NHS providers network, which I started that about 3 years ago, but you know, and at the beginning we barely could get people to attend the meetings, but now, you know, there is literally standing room only. So it's a model I recommend.
Could I just hi? Could I just add to that? It's John Banks here from Surrey, and I just wanted to flag a couple of things. One is that the memorandum of understanding for health and carers that NHS England are producing will be a really good opportunity to lever in those conversations. NHS England will be strongly advising that those memorandum go to the Health and Wellbeing Board. So if in some areas there isn't that level of engagement of health, it's a really good lever to open up that conversation. And the other thing, if I could just flag that the event on the 31st of March that Chantal mentioned, we've already got 102 people booked out of 150 places, so it's clearly going to go fully booked. So if you're not signed up yet, perhaps could you please book now to avoid disappointment, as someone once said.
That's great. Thank you, John and Debbie. And we will be sending a thank you email out to everyone, so we'll put information about how to join the event and that. We have one question for the Liverpool gang. So it says, do they have any tools to assess the mental health of young people post 17? SDQ only up to 17. Something for young people after 17 to identify what support they need and what the issues are. Currently focusing on looked after children, but want this to be for all young people and parents. So can the Liverpool gang, anyone answer that?
Yeah, hi, we've just popped that on now. Yeah, we use the WEMS scale specifically for our young adult carers. That's the Warwick and Brown. Yeah. Scale, yeah. Yeah, Yep, so that's the Warwick and Edinburgh mental wellbeing scale.
Okay, we just have one more thing being time.
Got to get this time, but I'll stay Jane. I've got me.
It just says, will you be able to share your joint policy and procedures for young carers? Jane, will that come through the North West Carers Aid Point? Lovely. Thank you, Louise. Okay, so some people are starting to sign out now, so we're going to close it down. See if anyone wants to stay online and chat more than one or two. But just to say thank you everybody for signing in, and particularly thank you to our trailblazers. So thank you, Louise, Debbie, and Lisa. And if you do have any questions, get in contact with us. Thank you, everybody.